Welcome to Learning from Indigenous Leaders, Climate Change and Public Health, a video series where we hear from various speakers regarding the effect of climate change on health, why it's important, and what both public health practitioners and the public can do to improve health in the face of climate change. This series was produced by the National Collaborating Center for Infectious Diseases, or the NCCID. The NCCID is hosted at the University of Manitoba, situated on the ancestral lands of the Anishinaabeg, Anishinaabeg, Dakota Oyate, Dene Sulene, and Naheithawak/Ininwak nations. It is also in the heart of the homeland of the Métis Nation. At NCCID, we strive to honor the lands and their original caretakers in our work. We acknowledge that we are on Treaty 1 land. We recognize that this and other treaties have not been implemented in good faith, as a part of an ongoing process of colonization that benefits some of us and harms others. We are committed to working with our partners towards reconciliation. In this video, we'll hear from Dr. Don Martin-Hill, so let's get to know them and the work that they do.
So I'm Don Martin-Hill, Mohawk Wolf Clan, reside at Six Nations, where I'm talking to you from. I am a grandmother of 9, mother of 4, and my PhD is in cultural anthropology. My background's in Indigenous ways of knowing and being and methodology and pedagogy and advocating. I got involved as a co-investigator in the Indigenous People Health Institute through Jeff Redding's inaugural tenure, and we had a RNet center, and I was insistent that the center be located in a community at a fledgling post-secondary. We were pushing really hard to make sure the funds went to Indigenous people, and that was kind of, I guess, my entry point in advocating for traditional knowledge, traditional healing practices, and being denied ability to apply for a grant, and working as an inaugural chair of the RNets. There were 9 at the time. And so putting together a group of people that could kind of sign up and say, yeah, this is our background, traditional healing practices and medicine. And so that was kind of my niche in Indigenous knowledge, of course, is the framework for that. Really important nuances in there. So just kind of creating the guidelines. And of course, at that time, most Indigenous people were not getting funded. It was pretty abysmal. And the TRC, of course, pushed CIHR to do more and do better. So I had to kind of give up what I was doing because I was afraid that if Indigenous knowledge wasn't authentic and true to its global kind of metrics of excellence, I didn't want it to become watered down version of Western science, just, packaged as Indigenous knowledge, which was kind of happening. So I did decide to do a lot of that heavy lifting, and there was a creation of an advisory group that I was a part of, and they did great work developing an iterative process. Because so many were good applications, they just needed, a few things. So we would mentor them rather than deny them. So from that, I think that they told me after we put those metrics in place for reviewing, applications went up by 64%. So that's who I am.
Why is climate change important to you?
I was recollecting back in 1989 as barely a master's student. I think I was in transition, trying to start an Indigenous studies program and bringing elders into the community or into university, which hadn't been done at that time. And every leader we had, the elders we had were like Thomas Binyaka, and he would talk about Hopi prophecies, and we had Leon Shenandoah. Like, these are legends in our world. I didn't realize at the time how incredibly lucky I was to have all these knowledge holders that were the top of their field, if you will. And, they all talked about climate change. They all were just really concerned. And so they were kind of where people are now, but this was when nobody was listening.
How does climate change affect infectious disease in public health?
We're going to see more and more viruses released. You have a lot of algae blooms. It's coming at us from many different directions, whether you have contaminated food sources, if you're living off of fish and so on. So we don't even know what's going to unfold, but I think every epidemiology study I've ever seen has been warning about this moment of just infectious diseases without even the climate change to exacerbate it all, right? So we do know it's going to, COVID is not over. It's set the era, like we're in a new era and we're going to have to adjust. And I think the thing with Indigenous people, we have lost 90% of our population due to these infectious diseases. We're well aware of the repercussions to our ancestors. So I think those are our strengths in these moments, is we know how to survive being hit like just wave after wave for our people. It happened from 15 60 70 right into this 1800s, and then the Spanish flu being the last one. But entire tribes were wiped out, and I think Canada forgets that, and our people don't forget that. We talk about those people, we know where they're buried, we honor them or acknowledge or dance for them, like they're still a part of who we are, even though that those people no longer exist. So we're well aware of the frailty of humans, and how important it is to do everything you can to possibly prevent the spread of infectious diseases.
How does climate change affect Indigenous communities?
It affects us in a pretty significant way. Most Indigenous communities are set up by water. I mean, that's just the pattern. So flooding and droughts. We just finished our study, and we're going to be dealing with that. Fires. Uh, when I saw the data at one of these climate change meetings for the boreal forest in the north, I realized, okay, this prediction is going to impact so many First Nations groups, particularly Lubicon, who I've worked with for 30 years. And I was like, do they have access to this data? Have you ever presented this 9-year study to the First Nations in Northern Alberta? Because they should probably have a mitigation measure or at least an escape route. And they were, of course, no. And that's what really bothers me. Um, is I go to these events across, because as an academic, and I'm knowing what First Nations are in these areas, and you just saw what happened in British Columbia with the flooding and the rains there, and those communities were left completely to fend for themselves, and of course they didn't have water. They're in the mountains, so the highways were gone. You can't just traverse the mountain. So they were really in trouble, and my big push lately has been getting after these agencies that are so well funded to do far better getting information and their research findings and data to First Nations communities who do not get resources to mitigate climate change like their local towns and uh, cities do. um, they get nothing. They're on their own and they don't have data. So much of the data that I've been creating through Global Water Futures, we're having to meet with all of the stakeholders, whether it's public works, meeting with health, now we're meeting with the economic development, et cetera, to try to give them the data so that they can create policies um, to make better decisions about where to put resources. but the federal government really failing First Nations on that front. They talk about guardians and traditional ecological knowledge, but they are not in any way supporting climate change mitigation measures, which every intergovernmental report at the UN cites Indigenous people will be the most vulnerable. They rely on harvesting the land and the waters, and they're not going to be able to do that. So food insecurity is going to be coupled, and we're going to be dealing with drought, which half of the world is already dealing with. We already have pretty horrific stats globally for Indigenous people, but for all people who are essentially in dire straits when it comes to climate change.
What can public health practitioners do to support health in the face of climate change?
I think knowledge mobilization is the biggest one, preparing people, like what Six Nations is doing. So Six Nations launched a really good plan for food security. And before COVID, when they were handing out growing your own food, and they would give them the seeds, they would give them everything, the box to grow in, regardless of the size of their yard or house. And only, I think they said only 20 people requested it. And then because they did such a good job in knowledge translation, I think they said they got over 500 requests, and they work closely with the food bank and so on. And I would say the other one is probably, at least with the health service providers that I work with, um, like I need them. So I bother them, even though they're busy and tired, to help me um, think about what do they need, like what are their needs, right? So that what I'm doing isn't just annoying them and just one more study, but that they are the contributors, and then they then become the translators to their clients and to the work that they're doing or where they're going to put their energy. So I think a lot of it is in providing services they've never provided before, because we're going to have, I mean, you can see mental health and the impact it's had, just COVID. Um, and we need more mental health workers. We need more outreach. They need more support, and they need broader support. So to address, and if you're in a disaster, and you're preparing, tornadoes that you've seen in Ontario, you're going to see an escalation of that. These are not, one-offs. These are expected to happen more so. So how do you prepare for that? Disaster relief. How do you get families to mentally prepare for those things, right? So again, it's exposure, talking about it, and I'm not saying giving out pamphlets, but finding a way to raise awareness without alarming people. That's why you need the mental health. That's why I have clinical psychologists helping me. Is I think that's the way forward, is preparing people so that you're not dealing with people who are completely helpless and haven't thought about what are my plans. So I think those are what I would consider broadening the service providers and the frontline workers, is helping them by adding to, I don't know whether it's creating more positions, but certainly they need help. I feel it's unfair that health has to take those steps, and hopefully by the end of this climate change discussion, you know, we can encourage other agencies to do better, do more, because Indigenous people are going to be and are already being hit very hard with the amount of flooding going on and the amount of droughts. It's one or the other, and that's just called instability of the climate. With the heat that's coming, because I've already done the climate change modeling, um, we already have people in distress over summers and the heat. And some of them don't have the ability to buy or have proper ventilation and air conditioning. So you're going to be having to do things like elder checks and really taking under, just like winter, you need to do the same thing now in the summer, right? You're going to need to find ways to mitigate those for those at risk in our communities. It, there's a lot that needs to be done, and I think climate change should be leading in many ways health, and wellness. And I've never understood why it's kind of a side note, footnote, um, and not being taken as seriously, knowing all the science that's before us. And the data speaks, the science is speaking. It's not good, and we're not really moving, in my view, to create policy and measures to address what's coming, whether it's heat exhaustion, heat strokes, children dehydrated, you don't have access to clean water, and then so there's just so much there. It could be an entire course.
What can everyone respectfully learn from Indigenous knowledges on this topic?
Coming into things with a holistic approach, that, water and infrastructure and housing is a social determinant. The holistic, land-based healing is very important to Indigenous people. And then there's other factors like residential school survivors, and being, in a hospital with a certain setting can be really triggering for them. So there's a lot of trauma-informed care, if you will. Um, Women don't get uh, gynecological support and help because of sexual abuse that is pervasive and many experienced. So it's like these, again, sociological connections aren't made. They hear about one thing, but they don't understand the person in front of them. Um, you know, um, may have been a residential school survivor, and so they're not doing what you're telling them to do because they don't have clean water in their homes. So they can't do what you're telling them to do, whether it's sitz baths or, so there seems to be that disconnect. And if there was a way that we could kind of just look at it with an Indigenous lens, and reality, the good and the not so good, that I think, then anybody coming, new immigrants, Muslims, it feeds into, understanding human beings a little bit, just getting a context. And I know that's asking a lot of them, but I think it is what makes somebody get better and out of your hair and less difficult than to just, like I say, just humor us, like I'm not, you just humor us. So I think those things are really important. I was involved in the case with the chemo being forced onto children from this area, and asked to intervene, and ended up going to court against the hospital, which is counterintuitive to me, but they were trying to, force removal of the child. And you know, it didn't need none of that needed to happen. Like, it could have just been sorted out in a room, right? But it right away went to people not understanding. You thought you were right many times. You believed this was what was best for us when you took away our children, when you sterilized us, when you put us in residential schools. The horrors of what we've had to go through was always coming in a settler framework as, this is what's good for you. We know what's best for you. And it's not worked out well at all. So it's kind of stepping back and saying maybe they do know what's good for them. Getting to that point would be really good. I think that would be my greatest hope, is just understanding.
Thank you for listening. All videos, infographics, and resources from the Learning from Indigenous Leaders Climate Change and Public Health series are available on the NCCID website.